to see you here today. Today I'm going to be giving you a full eye examination. This eye examination is vitally important. It just gives me a way to be able to check the general state and well-being of your eyes. This eye exam is going to be split up into various different tests, but I do promise to be as gentle and as relaxing as possible for you, because I know exams can sometimes be a bit nerve-wracking, but I assure you, you're in a safe place and you have nothing to worry about, okay? Great. So, before I begin inspecting your eyes, I just need to ask you a few very basic questions, okay? So, is this your first eye examination? Okay. Okay, good. And have you visited or seen a doctor in the last 6 months? Okay. And that wasn't linked to your eyes at all? Okay, good. Good. And can you say, are you on any prescriptions or taking any medications at the moment? Okay. And have you been suffering from any headaches or migraines recently? Okay. Great. Thank you for answering those questions for me. So, I'm going to begin this eye examination now. I will be using my light a bit later, but first off, I'm just going to do some very basic tests after just having a little inspection of your eyes. I'm going to very gently plant my fingers around your face just so I can have a bit of a better look at your eyes and the muscles around your eyes, okay? Great. Okay. So let's just have a look around. That's it. Just relax. I'm just having a look around. Just inspecting around both of your eyes. I'm just looking for any discoloration around your pupil and iris. That's it. Just feeling for any tenderness or soreness on the muscles around your eyes. Checking to see if your tear ducts are in good working order. That's it. Just relax and just being very gentle, just taking my time. That's it, just relax. Your eyes look to be, from a visual perspective, in perfect condition, but I do have some tests to do just to clarify how well your eyesight is holding up. And and see how well you can focus on certain movements and distances. Okay, perfect. And just okay. Have you been suffering from any kind of tenderness around the bottom of your right eye at all? Just about there. Okay. So it's been a bit sore. Okay, it does seem to be a bit red. It's probably nothing to worry about. It's just maybe it being winter. Our skin is very dry. It's probably just requires a bit of cream or ointment, which I can prescribe to you at the end of this examination, okay? Great, so I'm going to start by doing some tests. First off, what I'm going to do is move my fingers from a center position outwards like that, okay? What I need you to do is just focus on my fingers as they pull apart to the sides. Okay, let's go. Back to the center. That's it. Just focus, 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 focus. Perfect. And again, just focus, 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 focus. Focus, 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 focus. Great. And vertically this time. Focus, 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 focus. Great. Perfect. Now, I'm just going to be moving my pen very slowly to the tip of your nose. Again, I just want you to focus on the pen as it touches the tip of your nose. Okay, so I'm going to start out from about this distance here. And just focus, 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 focus. Okay, perfect. Focus, 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 focus. Perfect. Just one more time. Okay. Just great. Now I've got a bit of an unconventional test. I'm going to be tracing some random shapes in the air. I just want you to tell me what shape I have traced with my fingers, okay? That's it, and down. And this on my fingers. Okay. Correct. That test is quite easy, but it is a good sign, just a nice basic sign to see how well your eyes can track movement, and your eyes have dealt very well with a focus and tracking test so far. Now, I'm going to move on to the light part of this examination. I'm basically going to see how your eyes respond to the light, seeing how well they respond in terms of their sensitivity, but as also if they are dilating correctly as well. So first off, I'm just going to give you a general inspection again, but this time I'll be using this medical light. Please tell me at any time if you find it to be uncomfortable. Okay. Okay. Just relax. I'm just gonna have a look around your eyes. Just seeing how well your eyes are dilating. That's it. Okay. That's it. Just relax. You're in safe hands. Okay. Perfect. Just having a look around. Just looking at your left eye with the light. That's it. You're being very still. That's great. Perfect. Okay. Great. Now, what I'm going to do is swoop in the light from different angles. I don't want you to follow the light on this occasion, but I want you to keep your vision focused right in the center near my finger. When the light swoops in, focus on the light when it reaches the center, okay? says it all really. What I'm going to do is just move the light in certain directions, certain patterns. I just need you to keep heavily focused on where the light moves to, okay? Great. Okay, so just focus on the light. That's it. Okay. That's it. Just relax. Just follow the light. That's it. And up. And down, and up. And down, to the side, and back to the center. That's it. Great. And to the side, and back to the center. Great. And around. Great. Well, your eyes seem to respond very well to the light source emitting from my medical light. They're not particularly sensitive. You seem to be dilating correctly as well. So, in terms of the light tests, I think it's been a very good success. So, now I'm going to check your peripheral vision. This is a very important test. I've got some quite basic ones, but they'll do the job and make sure your peripheral vision is in good shape. First off, I'm going to be swooping in from the side with different amount of fingers. I just need you to tell me how many fingers I'm holding up, basically. Okay, so just relax. That's it. So, how many fingers am I holding up? That's it, coming from the side. That's it. Great. 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 Perfect. Great. Perfect. I don't know how many fingers I was holding up there either, to be fair, but okay. Great. Now I'm just going to basically get up to the side and just move my pen in front of your eye So just relax, relax, relax. I'm just seeing from a side perspective how your eyes respond. Okay, just getting up a bit closer. If you could try and focus. That's it, you got it. Congratulations, you're focusing very well. And again. Okay. Perfect. Just keep focused. That's it. Okay. Now from the other side, let's do it. Go in. Just from a distance first. Just tracking your eye movement. And back to the center. Great. Now up close, just relax and just focus. That's it. Very quick. Okay. And again, just focus on the pen. Perfect. Just one more time. That's it. Great job. Great, thank you for being such a lovely patient today. I can assure you your eyes are in very good condition and you have nothing to worry about. I'm going to prescribe you some medication, probably some cream, just for your sore eye, just under your right eye there. But other than that, I've thoroughly enjoyed inspecting you today and giving you this eye exam. Until next time, I'll see you about. Bye.